Gwen, I know you haven't been with us very long, well, basically this year, isn't it really? But just give me a little overview why you wanted to join us. Perhaps I think it was something you'd seen on the website that sort of related very closely with what you were wanting to work with.
I was interested in working for the Women's Health Clinic because you're a women's centred and women-based organisation, and I think a lot of the patients will benefit from that approach, where there's a degree of empathy and understanding, and allowing the time and the opportunity for women to explain how they feel with symptoms that are happening within their bodies that may possibly be being less well managed in other areas of our healthcare system. So I was interested in just being part of that service. I was interested in working from home as well.
Yep.
And building on my skills as a telephone triage nurse, and the flexible hours as well. So that was something that worked for my lifestyle.
Yes. I find it's a real privilege when we actually know that we're helping people, changing people's lives, and definitely helping everyone else. So it is very rewarding, isn't it? Yeah.
Yes, it is really good to speak to women, and they often say how much they appreciate just having the chance to talk about their symptoms. So whether they book in for an appointment on the telephone or not, they have the opportunity to explore their options and realise that there are options available.
Absolutely. So when you're not working with us, what do you like to do then?
Okay, yeah. So when I'm not...
When you're not working with us.
Okay, so I also work part-time for the Welsh Ambulance Service Trust, again on the telephones, doing triage assessments for a range of calls from GP out of hours to categories of ambulance calls, 111 calls, and have that is another job to this job I have with the Women's Health Clinic. I also have a son, and he's I'm a single parent, so I look after my little boy. He's 10, and I also teach and practice belly dancing.
Excellent. Tell us a bit more about that one then.
Okay, so I started belly dancing mainly to ease back pain, which I got when I was a student nurse, probably because I'd done some dodgy lifting when I worked in care homes when I was a teenager, to be honest. But I eventually found belly dancing after trying all sorts of different sports and exercise forms, and the belly dancing seemed to just give me exactly what I needed, and I've been hooked ever since. So I do a weekly class, and that's been going on for around 20 odd years now.
Wow.
And I just find it gives me that little bit of medicine. I get to move my body, meet with other women. So I've got obviously a lot of interest in women's spaces and women's groups, which is another reason why I was interested in working for the Women's Clinic, because it seemed to build on what I find happens within women's groups. And when women come together and the focus is allowed to be women-centred, is that something happens, women start to share their experiences and find commonalities, and it's therapeutic, whether you're having a giggle or talking about things that really matter to you in a safe environment.
Absolutely. Does it help with the pelvic floor?
Yes.
If you're doing it correctly?
Yes, absolutely. As long as you're not pushing down too much on the pelvic floor, there are certain moves you can do that will lift the pelvic floor and engage the pelvic floor. And especially if you do that with breath as well, you can exercise the pelvic floor in a sort of secret way, and it will enhance the dance, and it will improve the pelvic function and strengthen. It's a good way to do your pelvic floor exercises, actually, and we often incorporate that into our practice, whether it's in a warm-up or during certain moves.
Excellent. Thank you very much.